If a tornado, hurricane, or wildfire were to hit your community today, would you be prepared? If floodwaters rise or an earthquake shakes your world, have you identified the vulnerable residents in your community, and do you have an evacuation plan for them? We watched television in horror as Hurricane Harvey approached, and people were told to write their names and birth dates on their arm with indelible ink. Really? What kind of solution is that? As a community and a nation, we need to do better than that. Saving lives during a disaster has to be the first priority. 911 Disaster Plan offers a solution for your emergency preparedness team that solves two facets of preparation. 1. Identifying vulnerable individuals, and 2. Tracking them as they are evacuated. The emergency management portion of 911 Disaster Plan identifies the residents in your community with special needs, such as mobility impairment, communication difficulties, and dependence on special medical procedures. When individuals are clustered in a facility, data is gathered for that particular facility. By choosing a zip code or zip codes, emergency management teams can elicit a summary report, which shows the number of persons in each category of special needs. For planning purposes, you would use the summary report. If you were tracking actual evacuation data, you would use the detailed report. A detailed report of special needs allows you to drill down to the specific individual. When the disaster occurs, you can search by zip code for vulnerable individuals. You can also filter for the type of special needs, allowing you to prioritize for evacuation. For example, you can filter for all bedridden individuals in a certain zip code. As individuals are evacuated, 911 Disaster Plan tracks where they were relocated to, so that residents aren't lost in the system like they were after Katrina. In many cases, residents may be evacuated to a temporary shelter and then evacuated a second time. The system keeps track of each relocation by both date and time of the relocation event. 911 Disaster Plan integrates with Life Safety app, an online medical report that is immediately accessible in the event of a medical emergency. Because many of the residents with special needs have medical problems, this level of tight integration allows disaster teams to focus medical resources appropriately. The emergency medical report shows special needs or medical alerts printed at the top of the report, along with the person's medical conditions. Emergency contact information shows emergency responders who to contact under emergency circumstances. By having immediate access to information regarding diagnosed conditions, medications, and allergies, emergency personnel can make wise, life-saving decisions. Medical resources can be allocated appropriately. As the evacuation proceeds, your disaster team can view the overall evacuation progress by looking at summary reports that are updated on 15-second intervals. In addition to the on-screen display of the evacuation process, you can print or view a report of the individuals that have been evacuated. In each case, 911 Disaster Plan tracks the relocation and builds a statistical report. 911 Disaster Plan addresses the ongoing needs of any community, planning for an actual disaster by identifying individuals within the community that need evacuation assistance and tracking an orderly evacuation as individuals are relocated within the community or to another community entirely. If disasters should strike your community, are you prepared? You can be with 911 Disaster Plan. 911 Disaster Plan organizes your emergency preparedness teams to meet the evacuation and resource needs of individuals in your community. Call now for a personal demonstration. Phone 928-208-4820.